Hi, my name is Marissa Harper, and my topic is healthcare disparities in the LGBTQ plus community. My first interview was with Sarah. Sarah is a Hispanic Guatemalan Mexican and had issues growing up in a Midwestern town since she felt different from all of the rest of the students who were mostly white. This made her feel inadequate. She just wanted to blend in with others, yet despite efforts, she was treated differently because of her race. Also, despite her being a U.S. citizen, she has a lot of anxiety about the recent political environment and her race. In my second interview, I interviewed Steve, who is a proud cisgender gay man. Before he came out, he was not so proud when he was in high school. He was frequently called slurs, and people used to make fun of him. He was depressed and sad as a teen because of the harassment and being different. Finally, when he moved out of the state and could start a new chapter in his life, he is now running pride events for the company he works for and is the happiest he's ever been. Steve suffered from teenage anxiety and depression and had issues with physicians and had to request LGBTQ plus physicians. Steve's interview was why I picked the healthcare disparities in the LGBTQ plus community. I picked the topic because my second interview revealed that there are specialized health-related issues in the LGBTQ plus community, and there are not a lot of healthcare providers who are aware of these patients' situations. I also thought this was a topic that all public health and healthcare professionals should be mindful of, especially because this community is a growing population. When you look at the growth in the LGBTQ plus community, you see in 2012 only about 3.5% of people identified as part of the community, and in 2024 it has over doubled to 9.3%. This means that healthcare professionals today will have greater exposure to the LGBTQ plus patients and need to address the disparities that exist in their community. So what are the LGBTQ plus healthcare disparities? Their disparities are in physical health, mental health, sexual and reproductive health, and organizational and structural situations. And I'm going to talk about each one of these. As far as physical health disparities, this community suffers from an increased cancer risk because they use prevention services less frequently and have more exposure to hormone therapy. There is increased tobacco, alcohol, and substance use in this community. There is also an increase in chronic diseases such as diabetes and a higher prevalence of cognitive issues like Alzheimer's and dementia. From a mental health perspective, over 25 studies showed LGBTQ plus individuals were more likely to experience anxiety, depression, and suicide attempts. Specifically, there are high rates in the transgender community. LGBTQ plus are more prone to emotional distress and mood disorders because of cyber and physical bullying during their schooling. There is also an increase in mental health issues in states that don't have equality laws that protect LGBTQ plus populations. There are also numerous sexual and reproductive health disparities. There is a higher risk of sexually transmitted diseases and a higher risk of HIV and AIDS in the community. This means professionals need to encourage testing, acknowledge the risk, and be aware of current antiviral treatments. Additionally, people are living longer when they get HIV, and right now there are 38.4 million people in the world that have HIV. The LGBTQ community also has to deal with structural differences in healthcare settings. Most have less medical insurance, and many have limited benefits for domestic partners. In the systems of medical facilities, gender identifiers are often missing on medical records, or people have misidentified gender or biological factors. That can result in missed screenings and medical confusion. Additionally, when medical research is done, there are very few in corporate LGBTQ plus individuals. So why are there all these health disparities? There is stigma and discrimination, fear of medical professionals, lack of providers, and lack of training. There's a lot of sexual stigma where people feel that the LGBTQ plus community has an inferior status and applies disregard to them. That stigma, existing with discrimination, can cause chronic stress, which over time will cause physical and mental health problems. This has even been hypothesized in Myers-Minority stress theory. Also, there are examples of the discrimination all throughout a variety of medical studies. In some, medical staff have shamed transgender individuals, and in other hospital surveys, 10% of lesbian veterans has experienced harassment. Another 10% refused treatment, and transgender patients not only reported harassment, but even violence from some providers. So, can the stigma discrimination reduce life expectancy? The life expectancy of sexual minorities have shortened by how many years when they lived in community with high levels of prejudice or discrimination. Could it be 2 years, 5 years, 8 years, or 12 years? If you guess 12 years, you are correct. Stress and discrimination can reduce 12 years from your lifespan when you live in these situations. The LGBTQ community has the fear of medical professionals. They fear being outed to family members or employers, being forcibly hospitalized for seeking mental health care, being blocked from medical treatment or prescriptions, and they have fear because they have previously experienced a traumatizing event with a medical professional. And amazingly, even today, there is a fear that they could see a provider who would view their behavior as a disease and try to endorse a practice such as conversion therapy to fix them. So is this fear really justified? Well, according to a survey of sexual and gender minorities, what percentage has experienced refusal of medical care, rougher physical abuse, harsher abusive language, or refusal of physical contact in a medical setting? 10% of the population, 20%, 35%, or over 50%? If you said over 50%, that answer is correct. The LGBT community has experienced some type of situation that has instilled fear in them. The lack of providers in this community has been seen by the U.S. Department of Health and Services, which noted that there is a statistical shortage of competent providers. In surveys, the number one mentioned problem was a lack of qualified providers. The respondents said things like there is a limited number of trans-specific specialists and there is a lack of trained therapists. Additionally, where you live can affect the lack of providers. Rural areas have fewer providers and resources than urban ones. Unfortunately, even in the existing providers that are out there, there can be a lack of training. Recent surveys showed that education in U.S. medical schools was lacking, that out of 4 years of class, only 5 hours of training was dedicated specifically to LGBTQ plus individuals, and many medical students felt that they were unprepared to address concerns of transgender people. 80% of nurses had no training on LGBTQ issues, and that only 13% of dental students were educated to work with LGBTQ issues. So how do you reduce disparity? At the VA Boston healthcare system, there was a case study in disparity that served as a model for how people can make improvements to make LGBTQ plus disparities get reduced. Organizationally, they formed diversity committees, created LGBTQ plus policies, conducted studies to identify areas of improvement, and participated in the National Healthcare Equity Index, Structurally, they empowered staff and patients by encouraging participation in Pride events and promoted healthcare education by using posters, table displays, and websites to target this population with important healthcare information. Clinically, they trained providers and staff during orientation to improve interaction with the community, provided continued education, created support groups, and participated in conferences to be open to new information. In conclusion, the LGBT community is going to be encountered by healthcare professionals. More frequently, medical specialists need to be more alert about what patients with different backgrounds require. They need to use terminology that is appropriate so the doctor's office feels like a safe space. Medical charts need to be examined for missing health screens, and depression and anxiety screening should be performed by providers. The easiest way you can reduce these disparities is through education and acceptance. Take specialized classes and continue your education and be the change.